Hi, and welcome to Two Women and a Mic. My name is Alice Emerson. I am an author, a speaker, and a certified divorce coach. And I am your host here at Two Women and a Mic. Two Women and a Mic is a podcast that brings two dynamic women to the microphone, and we talk about topics that are agreed upon that are making an impact in this world. So if you are a woman of impact, I want to hear from you as well. So tune in and listen to our next guest. My name is Alice Emerson. I am your host with Two Women and a Mic, and we bring two women together to talk about women who are here making an impact in their local community and global. And that's pretty much what Maria is doing with her Breast Implant Safety Alliance. And today we're going to have a conversation about breast implants and informed consent, which almost to some people, this is a hot topic. It's a hot topic. And you've been having this discussion for a while back. And I know we talked about this. I think it was probably 2019 or 2020, somewhere around there. We did a discussion when you were starting the advocacy work.
Yeah. Let me just introduce myself.
Yes,
my name
please.
is Maria Gmitro. I think you said Gmitro.
Gmitro.
Sure. I know it's unique. It's Gmitro, and some people don't know whether the G or the M is silent. It's not. It's Gmitro. I'm a former educator, taught K through 12 as well as college. I've taught dance and drama, educational technology. I have a master's in instructional educational technology. I had breast implants placed in 2014. Is it all right if I just...
Please, yes. Tell us your journey, because I want to know the how and why you're doing what you're doing.
Okay.
So how it got here.
So in 2014, I thought about getting breast implants. And at that stage of my life, I wasn't having any more children. I had breasts that were two different sizes, wasn't a big deal. But at the time, I thought, well, maybe I'll have that corrected. We're hitting an age where you're kind of trying to hold on to your youth, and, having breast implants might have, lifted and given me that feeling. And when I consulted a plastic surgeon, I was nervous because I remember the 1990s and hearing about women that had issues with breast implants. And he even brought it up before I mentioned it. He said, "Did you hear about the issues from the 90s?" He said, "Well, they fixed all that, and these are the latest and greatest FDA approved breast implants." So I thought, oh, well, okay, so they fixed all those issues. Okay. I knew other women that were getting similar implants, and I knew that they were putting these implants into patients that were battling breast cancer. And so I had the implants placed. And within just a few months, I started having some strange symptoms. Weren't a big deal at first, rashes, and started having some inflammation, and just kept going, maybe some more increased fatigue. And then those symptoms started to become a problem. But my implants pretty much looked great. It wasn't until I'd say about a year into having breast implants, those symptoms started to become much more intense. And I started to go to the doctor a lot more often. And then it got to the point where I had to see specialists, and I was having tests done. They were either within normal ranges. Things weren't very conclusive. I wasn't getting any diagnosis. And I got to the point where I had to stop my career in teaching because we needed to figure out what was going on with my health. I just did not have the energy to deal with the day. And I gained, weight, a lot of inflammation. And being on all these different protocols and all, some different medications, you would think I would feel better. I didn't. I also felt like breast implants were the only device. Actually, I take that back. I did have an IUD placed for 6 months before I had breast implants. My body hated that, removed that. But breast implants was really the only surgery I had. And, I always mark that down on new paperwork. Nobody ever brought it up. Nobody mentioned it. Nobody questioned it. Maybe my OBGYN might have been the only one. It wasn't until I heard of other women experiencing something similar, and they had breast implants and they were removing them and those symptoms are going away. I didn't want to believe that that would be true. I thought, how on earth could this possibly, how would I not know to watch for this? I knew to watch for capsular contracture when the breasts harden. I knew to watch for rupture. I knew these things, but illness, I didn't know to watch for. Went back to my plastic surgeon and he basically threw up his hands and said, the FDA says there's no connection to these symptoms. And then my husband brings out the manufacturer's paperwork and it, it says somewhere in there that, patients have reported these symptoms. And I thought, oh, I'm not lucky enough to win the lottery, but apparently I have won this unlucky lottery of, having these issues. So I decided not to choose him to have him remove my implants. And I
So it was
decided to go
at that
somewhere else.
point,
Yeah,
at that point that your husband brought you the manufacturer's
right.
information that you're like, oh my goodness.
And the only reason we really knew about that was because of other people, women speaking out about these issues. So I had my implants removed in 2017 and, it was a gamble. I didn't know. Some people, get better after. I mean, removing my implants was not going to magically heal every health problem that I possibly had. But when I did have healing, my husband and I looked at each other like, what is going on here? Why don't people know? And so I started volunteering and getting involved in the advocacy. I spoke at the hearing in 2019 in front of the FDA. I think there was about 80 of us there. And it was incredible to know that I wasn't alone. But it was also really upsetting to learn that there were women there that were diagnosed with a cancer that they wouldn't have had if they didn't have breast implants. And I felt like that was also something that wasn't common knowledge. So from there on, as a teacher, as a woman of action, I just decided to do something. And, I'm not the only one. There are other fantastic advocates out there that have come before me, that will come after me. I'm just trying to do my little part to create some positive change.
And bringing
here we are. And we've got lots to talk about, but I figure I'd take a pause there.
Yes, yes. Thank you for sharing your journey, and what a journey. And thank you for doing something with this story and impacting. I know you've helped a lot of women locally, but your work and your advocacy and the awareness. So your foundation is a nonprofit. It's Breast Implant Safety Alliance. And I just read 2 articles on there that were just published this month. In March, one being today, actually, that I had seen there. So you have a wealth of information. So there's a lot of change. There's a lot of information that is coming out. But we started this with informed consent. And you're an educator. You're a brilliant woman. Your husband was involved in this decision-making, like, or were you alone? But either way, the informed consent, let's talk about that, because I'm not so sure how informed you actually were, or anybody is still to this day.
There's a lot to unpack here. I will say that my husband and I went into this decision together. We felt like we had, done the research. He's very supportive. He witnessed my health decline and then me regain my health. He's been a witness to all of this. And this is why he feels so strongly to support me, through this time of advocacy. When we think about informed consent, I want to say this. I do not want to take away anyone's right to do what they want to their body. If you want to get breast implants, I just want you to be informed. I want you to have the information. I don't think that anyone should stop the public from having the information they need to make an informed decision. I wanted to, get that out there. I do want those breast implants to be safe, tracked. I want better safety measures in place so that if you are choosing to have implants, you're making a choice knowing that there are those of us just trying to make that whole process safer for you and making sure you have the information that you need.
Yeah. So, what information is given? I mean, I know you mentioned that this inflammatory response, like all of the illness part, and it is an illness, and it's been tagged as such, the breast implant illness, right?
Yeah, I mean,
BII.
call it whatever you want. In fact, I think they should keep it a name that people will recognize. At this point, that seems to be the name that most people are using. The FDA refers to these as systemic symptoms that are reported by patients. So coming back to informed consent, in 2020, we had asked for a black box warning in 2019. In 2020, they released the language for a black box warning. So now all breast implants, whether they're smooth, textured, silicone, or saline, they all come with a black box warning. They're a class 3 medical device, which means they're in a category of something like a pacemaker because they can cause serious injury or death. And a lot of people don't realize that it's a class 3 medical device. The data, plastic surgeons will say, and I love plastic surgeons. I'm not saying anything against plastic surgeons. We need them. They do some great work. But there are some plastic surgeons that will say, this is the most studied device. Well, maybe, but what we don't have is good data on breast implants because they are not properly being tracked. Right now, back in, I believe it was 2019, there was a recall of textured breast implants. It was a particular style. It was the Allergan BioCell, but it went by many different names, which was super confusing for patients because they thought, well, I don't have the Allergan BioCell, I have Megan. And it was the same implant. So that was already confusing. The implant manufacturers lost track of who had these implants. The doctors lost track of who had these implants. So we still find women today that don't know what's implanted into their body, and they don't know how to find out what's implanted into their body. So these devices just really have not been tracked. There are some registries, some tracking that has started more recently. The issue with that is that it's the plastic surgeon that's putting that information in. Great, we're starting. We need to do better. This information doesn't exactly reach the FDA. So sometimes when people are quoting studies, they're quoting rates where we really don't have the data or the information. So I find that very concerning. And who is reporting your problems with your breast implants to the FDA or with any device, right? You're lucky if your surgeon does do that or your healthcare provider. At this point, to make yourself count, you have got to be the one that goes to FDA's MedWatch page and let them know of your experience with breast implants. And if you were somebody that had complications, make sure you're counted. If you've removed your implants and you started doing better, report, you can update that report to the FDA. People don't know to do that. And that is not, it can be tedious and time consuming. So I can understand it being hard for doctors to also have to do that. So you have to be able to self-advocate and self-report. So we need better data on implants.
That's important. Oh my goodness. Let's talk about that FDA reporting just for a moment. Like, pay attention to this. I know the link is also on your website, which is bisanonprofit.org, right? Correct.
Yes,
bisanonprofit.org. And the link there is there. And it's just not for implants. It's any adverse effect because it's not the doctor's responsibility. And correct me if I'm wrong. It's not the surgeons. It's nobody else's responsibility, or have they changed that? They're not mandated.
They're not mandated. The manufacturers, I guess, are mandated, or hospitals are mandated. However, I think it can be subjective on what they're actually putting in as a report. So that's concerning.
Right. So just to make sure you're counted, be your own advocate. I think that's something that I believe that just goes with your name, your own advocate. your personal advocate. You took action, you did the reporting, and you know, in taking them out and recognizing the healing that you were having and doing this work is just really, really important, that people know that you have to be able to stand up for yourself, know your body. And
Yeah, I mean, that's a good point. I'm not a doctor, right? But I am an expert on how I feel. So you are an expert on how you feel. And there is a lot of, sometimes it's intentional, but mostly unintentional gaslighting. Just because a doctor might not have an answer doesn't mean that there isn't a problem. You know when there may be a problem.
that's true. Yeah. And you feel like it's in your head because sometimes there's no test, you know, showing something. But if you're, you know, you have to continue to fight for yourself. And I'm so glad you're doing better. You can see it, you know, just over the years, just watching you glow. It's been an amazing journey to see this and to witness this and how we're helping other people. So another thing that I noticed is a conversation that we had is, you know, um, what we know and what we don't know about breast implants, right? Because we have different people wanting them, right? You want to feel better. You want to fight aging. You want a lift. You want to be perky again. You know, there's a lot of cosmetic reasons. It's not for anybody else but yourself, right? And you want to feel good about it. And then there are people who are having reconstructive surgery after having to have their breast removed due to cancer.
Mhm.
And so for those people making this decision, right, whether it be for cosmetic, well, it was one to all cosmetic, but now some of it is covered when you're having a mastectomy, I believe. I'm not an
Yes.
expert in this, so this is more a question.
Yes.
But like, what would you say? We know some things and what we don't know. So how can somebody be an advocate in making this decision outside of just the marketing material that they'll get?
Yeah, I know that a lot of patients facing breast cancer, battling breast cancer, or having the gene mutation, they often feel very rushed in having to make this decision. And you have options. You can actually choose to not have reconstruction at all. You can choose to have something called aesthetic flat closure. And I've got friends over at notputtingonashirt.org, and I worked with the Stand Tall AFC campaign. Sometimes when a surgeon is removing the cancer and you're not having reconstruction, it can leave a bit of a mess, or these dog ears on the side. Aesthetic flat closure is when they go in and they just cut off that extra skin and try to make it as smooth and flat as possible. To me, it's like kind of a ballerina look. I think some people, the more reconstruction you have, or if you're choosing to have breast implants, there are complications that come along with breast implants, whether you're an augmentation patient or a breast reconstruction patient. So it's going to mean multiple surgeries. You're going to have to decide over time, do I want to remove my implants? There are certain surgeries where they might use some mesh. Some is synthetic. Your body might have a reaction to that synthetic mesh that might be used in some of those reconstruction surgeries. Even if you're not having implants, you have to be cognizant of the mesh that might be used. Take your time, do your research. Your doctors certainly mean well, but you really need to be presented with all the options and the information, which I know can be, overwhelming at times, but, don't take it from me. Do your research and see what other people are saying and experiencing. And just know that sometimes issues with breast implants are not conveyed to the public. And we think you deserve that right to have all that information when you're thinking about making those choices.
All of the information. Yeah. And that's why it's so important for everybody, past patients, people who are already experiencing, maybe they don't have any problems. I know some people that have zero problems with their implants as far as they know.
Yep.
Right?
And great. The longer you keep breast implants. I keep hearing this, idea of 10 years. Removal. I mean, who decides when is the best time to remove your implants? I would say yourself and working with, your care team. But the longer you have breast implants, the chances of experiencing a complication does go up. So they aren't considered to be lifetime devices, although there are certainly patients out there whose bodies were able to, protect them and they didn't have problems. So I want to recognize that part as well. Me, unfortunately, my implants were not ruptured. They came out perfect and pretty, just like the marketing brochure shows. So I didn't have any rupture or anything.
No, but you had the other response, the systemic response. Your body just did not like it. I guess it's something foreign to our natural body system, and it does react. So
it does. I mean, there's an inflammatory response. The scar tissue is evidence of that, right?
Evidence. Yeah. And speaking of scar tissue, I don't know if you want to go here or not, and we can lead people to your page to read about it. But I think it was just March 9th. There was information.
Oh,
March 8th. Yeah.
Yes. So something to keep in mind, there is a lot of talk about when you remove implants. A lot of advocates discuss removing the scar tissue that is around the implant. There's different methods for the way that's done. We believe you should have all the information so that you can decide and work with your plastic surgeon on what you think is best for you. I will say that we know that there is a microscopic bleed of the silicone, whatever the chemical composition of the implant. It might, it does bleed out of the implant, so it does go into that scar tissue. There are cases of patients that have removed their implants, and if they had the allergen textured BIOCell, and I'll be honest, there are still some of these textured implants on the market that aren't recalled, I shouldn't say banned, that aren't recalled, that are causing this cancer. They are still in use today. So some of the patients that do remove their implants and they leave that scar tissue in, that lymphoma has actually developed. March 8th, 2023 was a follow-up to an update from the FDA safety communication back in, I believe it was September 2022, where they talked about squamous cell carcinoma that was developing in the breast implant capsule, scar tissue. And that's another reason that it's another cancer that somebody wouldn't have had if they didn't have breast implants. And unfortunately, we don't have a lot of data and information on this because, again, breast implants haven't been tracked well. When you have problems, a lot of times you're not going back to your plastic surgeon. You are seeing other doctors. They're not knowing to make these and file these reports. The FDA has admitted they need more information. So any doctor listening to this, if you've come across these cases, please reach out to the FDA and report to their MedWatch system. This cancer is aggressive. And the problem with these cancers is that it's very hard to detect on imaging, routine imaging. It presents maybe swelling, maybe in some, maybe some pain, maybe some redness. It's just that these things overlap, so it's really hard to tell.
There, yeah. Is it rare or is it because we don't really know because it's not really being reported, right?
Well, they thought that BIA-ALCL, the lymphoma that was linked, has been associated with the textured implants. When they first started talking about that, they thought that was rare. But the numbers, I mean, it was at first, I don't know, I don't remember where, but we got down to, I think, 1 in 300. And do not quote me on this, but I'm even hearing possibly soon that might change. It could possibly be 1 in 100. BIA SCC, the squamous cell carcinoma. Right now, there aren't a lot of cases that have been reported. We are hopeful this will be rare. And we hope that this does not turn into a similar situation as BIA ALCL. The difference with these two cancers is that one really has only been associated with a textured breast implant, or somebody that's had a history of a textured breast implant. Squamous cell carcinoma, in the reports that they have now, it didn't matter whether the patient was an augmentation or breast reconstruction patient. There were cases of smooth and textured implants and cases of silicone and saline implants. So that puts everybody at risk. And again, chances of that happening, we hope, are extremely slim, but we do think you should have access to that information.
And that's the point, is having the access to the information so you can make informed decisions, informed consent. Well, we need all the information, all of it. So, a lot of people in this conversation, and again, I'm going to go there with the FDA because everybody's on the FDA bashing, right? It's all FDA's fault. You're involved in this. You've been on the floor and presenting at the FDA. What is your take on that? Is the FDA really the bad guy? Maybe we should explain, maybe some people don't even know what the FDA is, right? Food and Drug Administration. What is their role in this? And are they really the bad guy?
Well,
in your opinion, this could be your opinion.
Well, that is a loaded question, and people are going to look at my opinion. I think that the FDA has meant well. And when I was there earlier this month, I did a tour, the history of the FDA, which was fascinating. And going through and seeing what the FDA had done earlier on to protect the public was really incredible, because if it didn't exist, there were products being marketed to people that were harmful. There's also a section that they call the Chamber of Horrors. It's things that were once FDA approved, and once they had better data, they took them off the market. And the doctor, I wish I could think of his name. He was fascinating. He was full of knowledge, and he'd been there for a long time. He said that they were going to be working to make these exhibits virtual. So that was very interesting. I think that people don't understand what the FDA does. I mean, the FDA, I think, does the best job they can do with the information they are presented, which is presented from, let's say in this case, the manufacturer. And it's demonstrating that they are meeting specific requirements. And when the FDA has different information, they can alert the public, they do make changes. They don't often recall any device. They normally would not be a mandatory recall. Sometimes it's just a voluntary recall. But the FDA, aspects of it are funded by implant manufacturers, or not by implant manufacturers, just manufacturers in general. And I actually was a consumer rep on the medical device user fees, and every 5 or so years that's amended. And we pushed to have more money spent on analyzing adverse event reports and better communication, better alerting system. The negotiations in that part with the manufacturers happen behind closed doors. The public can't see that. So we tried, several advocates tried to do our best to present what we'd like to see happen. So I think when something's FDA approved, it just may not be safe for everyone forever. Our bodies are not all the same. So you just have to take that into consideration.
Yeah, that's true. Take that into consideration, because like you said, there is that Chamber of Horrors. There are things, and it's really like even in our own lives, when we know better, we do better. And so as they gather more information, and as you, the patient, be your advocate, report it, go to what is it called?
It's FDA's, you just can Google FDA MedWatch.
FDA MedWatch, go there.
Try to have as much information as you possibly can. You might want to definitely make sure you have any device information if you have that available. But all the information that you can give the FDA, the more, the better. So set aside some time. And this is one of the most important thing you could probably do, because the FDA is not getting all of that data from anybody else. And something else important to note, that right before we spoke at the hearing in 2019, there was a process called alternative summary reporting, where manufacturers, when there was a problem, they didn't maybe have to report it until like it happened so many times. The way that ended up being counted in the data, it skewed what the data actually looked like. It skewed, how many of these adverse event reports were, being shown to the public. When they released that data, it was, I think, over 300,000 reports that had previously been hidden. So on the eve of the hearing in 2019, this was the information that was, pushed out to the public. So that was very unfortunate. And Commissioner Gottlieb stopped that practice. And I don't believe he started that practice, but as commissioner, he stopped that practice. So there was lots of other implants that this impacted, such as dental implants. And we got better information there.
That's a good point. We are talking about breast implant safety, and your organization and your work, but we're talking about all implants, right? And report it. Knee, hip, heart, mesh, dental implants. Be your own advocate, and not just for yourself, but for other people. And I believe the FDA can do better if they know better, because if they're getting their information from the manufacturer who has a very high financial investment, it may not always be, and it may not always be as accurate. I'm just saying it may not be, right? When you have financial interest here. But in addition, when you're specifically dealing with the breast implants, right? And you're dealing with the illness and the side effects that you may be experiencing, you're not even thinking at first, similar to you, right, Maria, that you're not thinking initially the breast implants. You're thinking, wow,
You don't want it to
I've
be
been in the best shape of my life. I mean, you were healthy. You were like at the prime. You were feeling great.
Played tennis, did Pilates, did all the things, was teaching full time, and occasionally, some college courses on the side. I didn't, and as an educated woman, I didn't quite know what to look for. The great thing about the advocacy work that's happening now, back then when I was trying to research before I had implants, I saw the issues from the 90s, but everything that was coming up was really presented from a manufacturer's marketing standpoint. And I wasn't seeing a lot from patient advocacy groups. Now, as more people are reporting and more people are sharing their experience, that information is reaching the public. And, we don't share this information to scare you. We just want you to be more informed than we were. I certainly do not want to stifle innovation in this work, because we need medical innovation. We need medical devices. Some medical devices are, unavoidable. There just might be one that might be better for you and your particular lifestyle. I would really be cognizant of that, especially, like a shoulder or a knee. It really depends on your lifestyle. And this is what I've heard over and over again. When I got involved in this advocacy work, I knew it didn't stop at breast implants. And I started working with other patients that experienced issues from mesh, from the Assure device. Actually, it wasn't a medical device. That ended up coming off the market. A really great documentary to watch. I believe it's still on Netflix, and I have advocate friends and colleagues in there. It's called The Bleeding Edge. It's a couple years old now, but it really gives you an overview of some of the issues that we're facing today and how medical devices are approved. It's a much different process than prescription drugs. And it would be so great if, I wouldn't want breast implants to be necessarily on advertisements on TV, but at the end of a prescription drug, at the end where they talk about all the problems that can happen, we all hear it and, we'll look at each other like, ooh, I don't know if I want take that drug, because I certainly wouldn't want that side effect. I mean, I think the same for breast implants is that, when you are going to advertise them, supposedly now that they have a black box warning, whenever breast implants are advertised, you're supposed to somehow see, the black box warning. But I just wish that was more prominent.
Can I ask you something real quick about the black box warning? Can you just, for somebody who may not know what that means, right? They're listening to this, their mom, their sister, or they themselves are going to, first be researching to get implants. What should they look for? What is this black box warning?
It's interesting you say that. So remember cigarettes, and the Surgeon General warning came out, and then on every box of cigarettes, they now had to have this warning, right? We all know now what cigarettes, they cause cancer. We all know this, right? We see it, you see the box. With breast implants, it's a little tricky because they have a black box warning like cigarettes do in a way, and it's on this box, but patients don't see that box. And you hope that the surgeon would provide that in their informed consent. They might, but you get a lot of information there, and you get glazed over, and maybe you're not paying attention. Maybe they're downplaying the risks. I don't know, but that warning does exist, and you need to be thinking about that when you have the implants placed. I would suggest anybody, if you're considering breast implants, try to get the informed consent from your surgeon and take some time to read it over, really read it over and look at it. I don't like the idea of going in, for a surgery and you very quickly having to look at this documentation. It's overwhelming. There's all kinds of risks of surgery, but I definitely think you should take the time to look at that. And better yet, go to the FDA's website and read up on breast implants there. Right now, with this black box warning and informed consent checklist, the FDA has required that the manufacturers only sell to doctors that are presenting this informed consent checklist to their patients. But there's no mechanism in place to make sure that is happening, I believe.
Right.
So we don't know is the answer. We don't know how well that's going right now, but implant manufacturers.
So we can tell patients, ask for the black box warning and all of the informed consent information. Now, this is a hard question to ask because if you're sitting in that office, let's be honest, you are excited, you are, or desperate, right? Depending on where you're coming from, whether it's after, whether it's for augmentation or reconstruction, you're usually sitting there with already in a yes zone and maybe don't want to know this black box warning. Maybe you don't want to know everything, but we ask you to rethink that. Maria, if you had been presented all of this, do you think you would have maybe made a different decision? We don't know, right?
Yeah, well, I can tell you that, we all make different choices on the risks we want to take, right? There's chemical assaults on our body all the time. The foods we eat, the, beauty products we might use. But in this particular case, I didn't want breast implants because of the issues from the 90s. And to know that it's the same issues, all over again, just repackaged in a little differently. And I think that they, in some ways that there was efforts to, stop these rupture rates and create a more, a better product. New doesn't necessarily mean safe. New means unproven or, has not been studied for a length of time. So consider that if you are considering getting breast implants and a doctor says, oh, this is a new FDA approved product, that, there's the safety data is excellent. It hasn't been linked to, these lymphomas, these cancers. It's because it hasn't been long enough. The I think one of the biggest disservices that the FDA and manufacturers did is to discontinue some of these post-market approval studies. If they didn't discontinue these studies, we would have that information now. It still impacts patient safety today. And, the way I was taking care of myself, no, I did not want to put a cancer-causing illness, inflammation-causing product into my body. And I fell for that marketing. And I just want to teach that next generation, be smarter. And if you're going to make the choice, be aware so that if you are experiencing these issues, you will know. And our director of BIA ALCL advocacy, Jennifer Cook, we talked and she said, when we will feel successful when a woman or individual experiences a complication or has an issue and they say, well, I was aware of this risk and I knew what to watch for. But they don't say, I didn't know. I had no idea. That's when we'll feel successful. It's not necessarily that people don't get them, because we don't want to take away your choice to do what you want to your body, but we will continue to push for better protection and better safety measures in place.
That's beautiful that they were aware. The awareness was there and it was worth the risk for them. And they knew what to look for, and how they will have to correct that. And it may include an explant.
Right. And I certainly do not want to shame anybody for choosing to get breast implants. I find that upsetting, and I don't think that should be happening. But making sure people are aware in a gentle manner is one of our goals. We want people to be themselves. We say be you, be proud, be aware, and we say knowledge is beautiful.
Knowledge is beautiful. Thank you for bringing your knowledge here today, Maria.
Just here to share what I know.
Yeah. And I do love your balanced approach. There is no shaming. It's just all informing, and knowledge is power, and knowledge is beautiful. And so to get involved with, or if anybody has questions, what's the best, what would you think would be the best place to go? Would it be the FDA website? Should they look up some of the foundations that are doing the work similar to yours? Like where would one start?
Start with Google, see what pops up. You don't have to take it, from what I say. You can go to the FDA's website, get some information there. We do have some links to some other resources on our website. That's BISA nonprofit.org. You can sign up for, safety alerts from us, you can put in your email. You can follow us on various social media. If you want to get involved in our advocacy work, contact us, send us an email. This is a grassroots organization. We are at this point just all volunteers volunteering, our time to help patients nationally and globally, some of us. So, we definitely could, use some help. Simple things like, commenting on our social media, sharing your story, getting more involved, making yourself count. And pretty soon we're going to put out documentation about tips for reporting into the FDA's MedWatch program and why it's important.
Oh, that's perfect. That's perfect for anybody with anything, but definitely in this movement, any implant. So thank you so much. Yes. Information to make an informed consent should be all information, just not the marketing, not the pros, but also the cons. And then
by the way, I just want to ask you, what is the function of a breast implant?
The function of a breast implant would be to, I guess I would say, lift and enhance somebody's, what they would consider their beauty of their breast.
But it's not something that's, functionally necessary, right? I just, when we think about, these particular devices, It is something that is not medically necessary. It is something that is marketed, directly to the public. So this is a little bit different than other medical devices. And I hope that no one ever feels like they need to look a certain way. There are definitely, flawed beauty standards out there, pushed out by industry. I've seen women that have no breasts at all, be, completely confident and beautiful. And that does, breasts do not make you who you are.
No, no. And thank you for saying that. That actually gave me chills, because I do believe that we're often looking outward instead of inward for the beauty, right? And I have met some of the people with yours. Is it the Stand Tall organization? They chose to go flat, and
Yeah, some of them chose to go flat, immediately. And some had some complications, or their surgeon decided, well, just in case you may, change your mind, we're going to leave some extra tissue. And some had, breast implants and had problems with their implants, and they had to go completely flat. Just remember that you are the one in charge. You get to make that decision yourself. And you deserve the right to have all the information presented to you so that you can make the most informed decision and do what's best for you.
Perfect. Best way to end this right now is to be your own advocate. Thank you, Maria. Appreciate you.
Thank you.
And reach out to Maria and visit her website, and stay informed and make informed decisions for you. Thank you.
You're welcome.